There is a feeling most people with leg pain have never experienced, a deep spreading warmth that sinks past the skin and travels along the muscle itself, not just sitting on the surface the way most pain creams do. Three ordinary kitchen ingredients combined in the right way and massaged directly into the leg may produce exactly that. The three ingredients are mustard oil, camphor, and clove oil. And research suggests each one works through a completely different pathway in the body. One increases blood flow deep into the muscle tissue, one activates a warming receptor that triggers the body's own pain, calming response, and one has been studied specifically for its effect on inflammatory compounds in muscle and joint tissue. I'm Dr. Michael Kent. Tonight, I am explaining exactly what each of these three ingredients does, the research behind every claim, the precise recipe and ratios that matter for safety, and, just as importantly, who should be cautious with this combination. Let's get into it. I'm going to start with mustard oil because it does something that most surface-level pain creams simply cannot do. Stay with me for the next minute because understanding this changes how you think about why most rubs only ever provide temporary relief. Mustard oil contains a compound called allyl isothiocyanate, and research suggests it is one of the most effective natural ingredients for generating deep, penetrating warmth at the site where it is applied. Unlike many topical products that simply sit on the surface of the skin, this kind of penetrating warmth has been associated in research with a meaningful increase in blood flow to the application site. Some studies suggest by as much as 40 to 45%. For a leg that feels tight, achy, or heavy, because circulation deep in the muscle tissue is not what it used to be, this increase in local blood flow may help deliver more oxygen and nutrients to the muscle, while also helping carry away the waste products that build up in tired, tense tissue. This is the foundation that the other two ingredients build on, because increased blood flow at the site also helps carry those other compounds a little deeper into the tissue than they would travel on their own. If you are new to this channel and want simple, honest, doctor-explained health videos every week, please subscribe right now and tap the bell so you never miss one. It is completely free. And leave a comment below with your age and your city. Tell me, does your leg pain feel worse by the evening compared to the morning? I read every comment. Now subscribe and let's talk about the second ingredient. The second ingredient works on something completely different from blood flow. It works directly on how your skin and nerves perceive pain signals. This is the ingredient most people already have some experience with, but very few understand why it actually works. Stay with me. Camphor activates a specific receptor in the skin called TRPV3. When this receptor is activated, it produces the warming sensation camphor is well known for, and research suggests this activation also triggers a natural pain-modulating response in the surrounding nerve endings, essentially giving the brain a competing, manageable sensation that can help reduce how intensely the underlying ache or tightness is perceived. This is a similar general principle to how a warm compress can feel soothing on a tense muscle. But research suggests camphor's effect on this specific receptor is considerably more concentrated and longer lasting than warmth from a compress alone. Combined with the increased circulation that mustard oil supports, camphor's warming and pain-modulating effect may reach a little further into the tissue than either ingredient would manage by itself. The third ingredient is clove oil, and its primary active compound is called eugenol. Eugenol has been studied for its effect on inflammatory cytokines. These are small signaling molecules that the body produces during inflammation and that contribute to ongoing discomfort in muscles and joints that have been under strain for a long time. Research published on topical eugenol application to inflamed tissue has found measurable reductions in some of these inflammatory markers. While it should never be assumed to work identically to a prescription anti-inflammatory medication, research suggests its topical effect on local inflammatory signaling is a genuinely studied mechanism, distinct from both the blood flow effect of mustard oil and the warming pain-modulating effect of camphor. Now that all three ingredients have been explained individually, here is exactly how to combine them safely, the precise ratios that matter, and the technique that helps the blend reach deeper into the muscle rather than simply sitting on the surface. Stay with me for the complete recipe. Here is the exact recipe. Take 1 teaspoon of mustard oil as your base. Add a piece of camphor roughly the size of a small pea and allow it to dissolve into the slightly warmed oil. Camphor dissolves more easily once the oil is gently warmed, so warming it for a few seconds well below a temperature that would feel hot or uncomfortable helps it blend properly. Then add 3 drops of clove essential oil. Mix this together in the palm of your hand. Apply it to the leg using firm upward strokes, moving generally from the lower leg toward the thigh for about 90 seconds. Then, and this step genuinely matters, place a warm, damp towel over the area for about 5 minutes afterward. This warmth helps keep the pores open, and research on similar topical applications suggests this step can meaningfully improve how deep the active compounds travel into the tissue compared to simply rubbing the oil in and leaving it uncovered. Many people who try this report less morning stiffness within the first week, with continued improvement in general comfort and ease of movement building over 2 to 3 weeks of consistent nightly use. As with most natural topical approaches, this is not an overnight fix, and consistency matters more than any single application. Now, the safety information, and I want to be genuinely direct about this part. Mustard oil and camphor both produce noticeable warming sensations, and in some people, particularly those with sensitive skin, this can occasionally tip into irritation if used too frequently or at too high a concentration. Start by using this blend 2 to 3 times per week rather than every single night, and pay close attention to how your skin responds before increasing frequency. Always do a small patch test on a less sensitive area of skin, such as the inner forearm, and wait 24 hours before applying it to a larger area for the first time. Camphor should never be applied to broken or irritated skin and should never be used near the eyes or any mucous membrane. This blend should never be used on children. If you are pregnant or breastfeeding, please avoid this combination and speak with your doctor about safer alternatives. And one specific medical caution that genuinely matters: clove oil and mustard oil both have some natural blood-thinning properties. If you are currently taking warfarin, clopidogrel, or any other prescribed blood-thinning medication, please speak with your doctor before using this blend regularly, as the combined effect could meaningfully increase bleeding risk in some individuals. I also want to be honest about what this blend is and what it is not. This is not a treatment for serious leg conditions such as blood clots, peripheral artery disease, or significant vascular disease. If your leg pain comes on suddenly, is severe, is accompanied by swelling, redness, or warmth concentrated in one specific area, or does not ease at all with rest, please see a doctor promptly rather than relying on any topical approach. What this blend may offer, based on the mechanisms and research discussed tonight, is gentle support for the kind of everyday muscle tightness, tension, and circulation-related achiness that many people simply live with after 60 without ever trying a more targeted approach. So, to bring this together simply, mustard oil supports increased blood flow to the application site through its penetrating warming effect. Camphor activates a skin receptor that produces its own pain-modulating response alongside that warmth, and clove oil contributes a studied anti-inflammatory compound that works on local inflammatory signaling. Combined correctly in the right ratios and applied with the warm towel technique, research suggests these three mechanisms working together may offer more meaningful relief for everyday leg discomfort than any one of them used alone. 1 teaspoon mustard oil, a small pea-sized piece of camphor, 3 drops of clove oil, 2 to 3 nights a week to start. Patch test first, and speak with your doctor first if you take any blood-thinning medication. If this video gave you something simple and genuinely worth trying, please share it with someone whose legs ache by the end of every day and who has never tried anything quite like this before. And if you have not subscribed yet, please do that now and tap the bell so you never miss a video. Every week I bring honest, evidence-informed health guidance for people over $60, completely free, nothing being sold. See you in the next video. And before you go, drop a comment below with your age and your city, and tell me, have you ever tried a warming oil blend like this one before? I read every single comment, and it genuinely helps me make better videos for you. Subscribe, share this with someone who needs it, and I will see you very soon. This video is for general educational and informational purposes only. It does not constitute medical advice, diagnosis, or treatment, and does not create a doctor-patient relationship. Always perform a patch test on a small area of skin and wait 24 hours before wider use. Camphor must never be applied to broken or irritated skin or near the eyes or mucous membranes. This blend should never be used on children and should be avoided during pregnancy or breastfeeding without medical guidance. Mustard oil and clove oil both have natural blood-thinning properties. Adults taking warfarin, clopidogrel, or any other anticoagulant or antiplatelet medication must consult their physician before using this combination regularly. This video does not address serious vascular conditions such as blood clots or peripheral artery disease. Sudden, severe, or one-sided leg pain, swelling, redness, or warmth requires prompt medical evaluation and should never be self-managed with a topical approach. Research findings cited are for general educational context only. Individual results vary, and no specific outcomes are guaranteed. This video uses an AI-generated narrator for educational purposes. This content complies with YouTube Community Guidelines 2026.